My name is Sheila McClelland, and I am indeed the Chief Executive of the Nursing and Midwifery Board of Ireland, which is the regulator for the 26 counties. We work with the NMC. I'm sure some colleagues are here from Northern Ireland, and as you can hear, my accent would give away that I'm from Northern Ireland as well. So we work very closely with the NMC in relation to regulation and to the way forward, which obviously I'll talk about a bit further on and whenever we discuss about how we need to ensure that relationship is maintained. I'm sure many of you will know what a regulator does on the three strands that we have responsibility for. The first strand is basically that as a candidate, if you're a student at the minute, as a candidate you have to register to be allowed to get a PIN and to go onto the wards. Once you go through the process of your programme and you acquire your degree, you can go on then as a full-blown registrant, and you have to renew your registration every year. So we maintain the register, and we've set the standards for you to get onto the register, and that's really important because we set up an entry point onto the register, which is effectively reflected in how we the programme content that you undertake as a student midwife in the 6 universities that provide that in Ireland. That also is the same entry point that we evaluate if you're coming from overseas. So we look as a European, you'll be immediately recognised as having acquired the entry point level of education. But if you are coming from beyond the EU, then we have to evaluate what education you've acquired. So it's really important we set the standards for education, and that by extension we set the entry point for access onto the register. We obviously undertake fitness to practice, which is the bad and sort of dark end of the job. So if people are complained about, we would look at, is there veracity in the complaint? Do we need to pursue it? And how what sanction? Now it's very structured. It's a very formal process, but effectively, what sanction might need to be applied, or corrective action. And then the third point is that really we ensure that people are returned to the register, restored to the register, if they deemed to want to do so. Yeah. So that's just come back to what I said earlier about what we do. We can make these slides available. So this gives you a breakdown of the different divisions we have and the specific nature of the midwives division. So you can see that we have 7,637 Irish nurses on the register, 2,029 that originally trained in the UK, EU trained 154, and non-EU 111. All right, so again, this gives you some insight into the numbers entering the register for the first time. And these numbers are smallish, and need to be more effectively, is the gist of what we're saying here. So you can see again, if you look at 2021, 224 came on from Irish trained basis, 10 from the UK, 9 from the EU, and 10 from the non-EU countries. We can see here, as I said earlier, there are 6 universities that train midwives in Ireland. And that's just in the Republic of Ireland, 6 education programs, and then there is an extra university that trains postgrads. And you can see on the right-hand side here, there's 144 places made available every year for midwives, for student midwives going on through the CAO points, and a small number of places made available for mature students, and then 159 postgrad places. So the 144 are highly sought after, a lot of competition. At an Irish level, it maybe doesn't read across so well into Northern Ireland, but I can probably equate it. But it's about 480 points, which is very high and very difficult to get into. It'll be like 4 A's at A level in Northern Ireland, so it's very difficult. It's at a very high standard. The 159 post-reg places are not filled fully, we think, on an ongoing basis, and we need to know why, and we need to find out a mechanism to make it, that option an attractive option, because there's a total disconnect between people wanting to go in at 18 and people then wanting to go in after they've done a primary degree, probably in nursing. So we need to think about mechanisms to populate and fill those posts, because we really do need, as you're going to see, we're going to need a lot more capacity. So this again is a telling bit of information, and the reason we can have this is because we have digitized the collection of the data, and we have much richer data now that will feed in at an international level about shortfalls in our resourcing. So you can see from this that we have 4,500, only 46% of the midwives on the register say they are currently practicing, and there's 3,869 working directly with service users, with women, and in the midwifery sort of forum. And again, most of the registrants, or 86%, are dual qualified at this stage. Okay. So this again is a telling slide about the age profile of midwifery in Ireland. So you can see that the bell curve is steered towards the right-hand side, which means it's an ageing population on the divisions, and we therefore need to address that as well. So we need people coming in, and Linda and I were having the conversation that people are going into the midwifery profession but want to travel, want to leave, and maybe leave the profession altogether. So we need to find a mechanism to get these, to make this bar chart look much more sort of healthy looking, to move the sort of the volume more to the left. And you're all part of how we do that. Just to talk for a minute, this is an All-Ireland event, and to talk about the impact of Brexit. So you can see the impact here. In 2017, we had 16 newly acquired onto the register. 16% came from UK trained. And people in this audience will probably know that it was an option that many students took to go to England, because the points are so high and so competitive in Ireland, that they went to England and went to the UK to get trained and then came back. That option is becoming more difficult. It's becoming less attractive, I suppose, or people maybe are nervous about what the ramifications might be if they did that. So, and you can see the drop off, which is significant at an Ireland basis, because we need those new midwives back. We need capacity to get them in. So we have been working very closely, especially with Northern Ireland, the Department of Health, and at the NMC level, to make sure that we create as little friction as possible. There's enough friction with the protocol and all those things. We don't want friction in relation to human resource moving up and down across the border. We are working with our Northern Ireland counterparts to make sure that where nurses and midwives are on a cross-border basis in a planned way, that they are going to be registered in both jurisdictions. And that is, I'm sure if you're part of that group, you'll know that the Department of Health and the HSE are paying for that registration. Also then, we're currently pursuing a bit of humanitarian legislation which will allow for very cover in an emergency situation, so that nobody is exposed as a professional, as a midwife. If you're attending somebody in a very, very much of an emergency, that can be used as a mechanism to cover your professional title. So we are doing our best, but the situation is, as the UK diverge, and there is new legislation going through at the minute about divergence in relation to professional qualifications and professional regulation. So the situation needs to be watched and maintained so that we can ensure that there is frictionless movement of resources from the UK into Ireland, and certainly on the island of Ireland. So COVID-19, I know Linda mentioned this, and of course it's foremost in people's minds, and I think, Linda, there's not much more I can say in relation to, you made the points very well about the disruption to services. Dawn would be keeping me very much abreast of this, that there have been some good points. It has shown agility. Midwifery services have adapted, had to continue, had to be very much changed, restrictions on who could get in to attend at the childbirth, etc., and beyond. We had this debate, some services that were rolling out well in some parts of the country were drawn back. The very same services were rolled out in other parts of the country. So there has been a bit of inconsistency, and I think that's what you're saying, Linda. So, but we need to, I suppose, build on the best and, learn from some of the less good examples of how COVID impacted on service delivery. We obviously, as a regulator, were heavily involved in ensuring that disruption to students and their learning pathways were minimised. So we tried to, and Dawn worked with her colleague Anne-Marie at the time to ensure that we understood where students might be disrupted, where they might have lost significant weeks and hours of training, and where that had to be made up. So we did our best to make sure that people moved on in an uninterrupted way and graduated at the right time. So there are some good news stories happening. The Women's Health Action Plan was launched just a few weeks ago, and there is going to be money. Linda, I'm sure not as much as you want, but for the National Maternity Strategy, there is money has been deployed to that from that. So there will be, I look into the future, there's definitely going to be opportunities. We just need to, as regulators, employers, unions, we need to be in a position where we're making sure those volumes are coming through. So I think we need to be very clear about how we position ourselves to do that. So just, this could be a circle, but I've done a sort of a timeline here about the sort of impacts. All these things are still live. So we had the National Maternity Strategy, as Linda mentioned. It's being rolled out, not as quickly as we had hoped. But there, as I say, there is some commitment now to spend on particular services through that recently issued plan. We've had Brexit in 2016. The ramifications are still being felt. And as I say, as a regulator, we are trying to work within the NMC and Northern Ireland civil servants and the Department of Health in the Republic to make sure that those that there is frictionless continuity of services, both in midwifery and in paediatrics. There's quite a significant impact, and in some of the very much more acute services. Sláinte care obviously is worth mentioning. There's going to be a shift left. Community intervention teams, the ECCs, and midwifery has a big part to play in that. COVID-19 we've talked about. So the State of the World's Midwifery report in 2021 shows significant shortfalls internationally in midwifery, and has the pointers for what they think would be a good roadmap to go forward. We would be hoping that we can, the semi-last slide is about the sort of key points of that report. And I hope that what we're trying to do at an Irish level is be upfront with that and be sort of ahead of the game. We have the Ukrainian humanitarian crisis rolling out in real time. We are bringing in professionals because they're coming as refugees. We are working with the HSE, with the Department of Health, and with partners to ensure that midwifery professionals who are coming in can be given some form of induction, some form of evaluation, and will be probably go on our register and be allowed to practice after a number of weeks. Also, students, there's a commitment from the Minister Harris, and we are living up to that. And so are the higher education institutions. They have been, last night I had a meeting with one institution who has a student ready to start. We're going to evaluate what shortfalls there may be in their training, their approach, and they will be inducted and they will be hosted in Ireland. The expert review body, we participated in contributing to the evidence gathering in that this time last year. And I understand that it's imminently going to, the publication is imminent. I think it's maybe going to the Cabinet today. I think there are 47 recommendations. There are 11 of those that the regulator will take forward. That will include workforce planning, which is what we can do because we can give the information. We need other people to help plan. And that's where our colleagues comes in, including the unions here. But the plans can be informed by the fact that we do have the data. For the first time ever, we do have data now that we can provide and can show and project, and you can see some of that information here today. So we will be able to say where we are quite granular in the data. We know where people are working, we know what they're working in. So we will be able to help inform where the shortfalls might be whenever there's a different angle to that about projected birth rates, etc. And demographic shifts, and actually sort of the spatial strategy there is for Ireland, where there's going to be the growth and conurbations, etc. So that'll all marry together to a much more informed position. Again, the expert review is likely to say, I understand, and we're already undertaking this, substantial curricular review of the undergraduate programme. So that's for both for nursing and midwifery. So we need to, and again, if we'll go to the World Health Organization report, it's saying that midwives need to be trained to operate as autonomously as possible at the top of their game to the widest scope. So we need to make sure that we're constantly evaluating what goes into the curricular content to give you as students the optimum opportunity in your learning pathway. So that is going to be undertaken, initiated imminently. And then we also need to look at enhanced pathways into the professions. So we need to look at graduate entry, and graduate entry probably from a wider set of options than just nursing. So it's thinking about people maybe wanting to make career changes, career moves, and how we can facilitate that. And finally then, the mentorship and leadership. So Linda has mentioned this, we need leadership at the top level in government and at a departmental level and in the big agencies like the HSE. You know, people can, there's more leverage the more senior the person is, and if the person comes with the midwifery professional background, they can empathise with the service provision of the profession. So it's really important that we have those people navigated through. So some of these people might be you sitting here in the audience, that you will find yourself with opportunities that you can progress through the grades and into positions of significant influence at the top end. That we hope will be facilitated and enabled by a mentorship. There's a mentorship initiative being rolled out at the minute. It hasn't been that well taken up by students or newly graduated, but there are a number of mentors that have been trained. The HSE are very supportive of this. So I would really, really encourage people, if you're about to graduate or newly graduated, to look for this option, because these people are significant players in the system. They're well positioned to advise you how to navigate and how to manage expectations and position yourself for your future. So finally then, I suppose we need to cross-reference against the State of the World's Midwifery report. And we can see the 4 boxes here. So, you know, again, I think we're hitting the right buttons here in relation to we're going to have the workforce data, which will help us inform the system what is required and how we should amend our training volumes, etc. Then we need the educators, the trainers, and the education institutions to be operating in the most modern way possible. We have a board member who says that we have the best trained and the most enabled nurses and midwives in Europe, but we don't propel that, and I think that's true, but we need to make sure we keep ahead of the game. We need to find ways that we are better able to celebrate that, but we need to obviously be very aware of what training content, education content continues to be relevant with digital inclusion, etc. We need to make sure that we are working in interdisciplinary teams, as we've talked about with Sláintecare, etc. So all of that needs to be respected, and I hope that our scope of practice standards that Dawn has recently produced and launched will all reflect that. And then, of course, the point that Linda made about creating senior positions in the health service, but also not just as Chief Midwifery Officer, senior positions, senior influencers and decision makers. So I would just ask all of you to, you know, not be humbled by the profession that you're involved in or the program of education you're currently involved in. You have the capacity to be significant influencers in the healthcare system that is current and is the future. So thank you very much.